So thank you very much for inviting me to this session. Let me share slide. So thanks very much to once again to Dr. Adu, as well as the organizers for inviting me to have a short sharing session with you this morning. I know that I stand between everyone and lunch, so it will be a pretty short sharing session for about 20 to 30 minutes. I work, my name is Wee Hoe, my family name is Gan, and I work at the Singapore General Hospital, and I'm the head and senior consultant at the Department of Occupational and Environmental Medicine at the Singapore General Hospital. So for this morning sharing session, what I've done is to really take a slightly different take from the proposed topic to cover, something that I've termed pivoting Singapore's occupational health system. So what do I mean by that? And I will explain it in subsequent slides. So this is some fast facts for all of us, but I think all of us being members of ASEAN, we are very familiar with each other's country, but nonetheless, some fast facts about Singapore. As of end of June 2021, our population in Singapore, very small, 5.45 million, comprising of which about 4 million are Singapore residents, and the rest are other workers as well as other non-residents within the country. The median age in Singapore, 41.8. The gender ratio, we have slightly more females compared to males. And the old age support ratio, right? And this is defined by the number of residents that's sort of in the economically active group from age 20 to 64 per resident who is age 65 years and above. So this works out to a ratio of about 4 as of middle of this year. So the employment landscape in Singapore on the graph on the left, you can see that from 10 years ago in 2011, the line in red, as compared to 10 years later, this year in 2021, indeed, our trend of aging workforce is mirroring that of many parts of the world. So our workforce in general is getting older. A larger proportion of our workforce are of an older age group as well across the entire spectrum. In Singapore, again, if you look at the work sectors, as at the end of 2020, a large part of our workforce are PMETs. Professionals, engineers, technicians. So you can also imagine that because of this, a large part of Singapore's job sector comprises services, manufacturing, and then construction. There's a very small percentage of others that and obviously we have some very small farms in Singapore, but these are by no means the dominant work sectors in Singapore, unlike in many parts of the world. So how are we doing in terms of our workplace safety and health, WSH? Compared to 2010, our 3-year average fatality rate from fatal work injury, is 2.6 per 100,000. And fast forward 8 years later in 2018, this has dropped to 1.4. And this is quite remarkable, I must say. But of course, we are not happy, and we want to continue working to reduce this fatality rate. And our goal is to, from now to 2030, we hope to reduce the fatality rate from fatal work injuries to below 1 per 100,000. So that was the goal that Singapore has set for ourselves. And on the chart on the bottom, you can see that in general, there is a gradual decline in terms of the fatality rates from work injuries over the years. So having given an overview of Singapore, what are some of the global imperatives that's shaping how we practice occupational health in the country? I think this is very familiar to everyone. Global megatrends, We are now talking about work 4.0, the fourth industrial revolution, when digitalization, artificial intelligence, machine learning, robotics, and many others are very rapidly being part of our work um, processes as well as workforce. And you can very well imagine, and it's already happening in many parts of, especially the services sector, where your work partner and your work buddy is not a human. Your work buddy is a robot, and the person that is calling in to the call center is not interacting and speaking and asking questions to a person, but to an artificial intelligence platform that has machine learning capabilities and is able to function as well, if not better, than a human in terms of the speed in which the AI can retrieve information and provide it to the person who has called in. Demographic shifts, I think it is very apparent to everyone. Our global population is getting older. Certainly, our workforces in many countries are also getting older. And there are other imperatives, rapid urbanization, with that also, changes and the changes that's brought about by climate change, which I'll cover a little bit later on, are all shaping how we are practicing occupational health today. So the global forces, I have summarized it in 5 points. The first one is of course the future of work. We cannot be doing business as usual, and in the same way, we cannot be doing occupational health and safety risk assessment as usual. Because now the future of work, as I said, we have brought in a lot more technology, digitalization, AI, machines, robots into the equation. And the ability of the normal human to work alongside and be able to be part of the integrative ecosystem with these technology needs to be assessed in terms of ability, speed and ability of reaction, of assimilating information. So a lot of things are happening even as we speak today. The second point is how work and non-work factors interact. And I think we all agree in this meeting that the traditional paradigm where we look quite narrowly at how work conditions and work factors affect health and health affects work is no longer sufficient. It is now more a triangular sort of relationship where the third perspective that we need to look at is really the broader environmental factors. Climate change, I've mentioned already. Climate change is real, and it is really affecting many parts of our work ecosystem. Companies are literally uprooting and shifting because of climate change, especially if they are in industries like agriculture, high-end agriculture that is very dependent on the climate of the day. We have also read reports as well as publications about how sudden death in very otherwise healthy and young male construction workers are happening, especially in many parts of the world, like Middle East, where temperatures are already hot, but because of climate change, that differential has increased even further. And for factories and workplaces that generate a lot of dust and particulate matter, climate change has also increased the dwell time of these residuals and is affecting the health of our workers. The fourth point is social construct of work and worker health. And this is a point which I spoke about much earlier, that we need to fundamentally start looking at occupational medicine and occupational health as not just directly related to work only and directly affecting the person, but look at it from a population perspective. And I'll elaborate a little bit more in detail. And the last but not least, while we are grappling with all the above, new and emerging areas in occupational health, the old enemies continue to be present, real and present. So asbestosis, silicosis, heavy metal poisoning, organophosphate poisoning, all these continue to be very real threats, not in many parts of the world, including in Singapore. And in fact, recently I've just review a scientific publication for a journal uh, that that talks about organophosphate poisoning in Singapore, and it is not common because of our shift away from agriculture as a big industry in Singapore. But again, it is happening, and we need to be always mindful of these old enemies. So the medium-term goal for Singapore against the backdrop of all these global imperatives is that by the year 2028, we want to have a healthy workforce in very safe workplaces. Everyone who comes to work in the day can expect to go home at night to their families. And we also want to be a country that's renowned for best practices in workplace safety and health. Of course, easy to say, very difficult to implement and achieve. And let me share with you some of how we are going to do so. So the four strategic outcomes that we are talking about is really to have very sustained reduction in workplace injuries, to minimize hazards that can lead to occupational disease. We want to promote good health in the workforce. And we want to, of course, adopt a culture where zero accident is a very achievable goal. And it's not just a pipe dream, not just an aspiration. So the three strategies that Singapore is going to take is that we want to strengthen workplace safety and health ownership. So traditionally, the workplace safety and health ownership in a company, for example, or in a workplace is very often undertaken by the occupational health nurse or the occupational health doctor that is attached to the workplace. But increasingly, we want to ensure that there is employer ownership and there is worker ownership. And how do we do that? So going forward, what we may well do is that in any business decision, for example, if there is a government contract and we want to award the government contract, what the safety record of and the health record of the company is one of the evaluation criteria on whether the contract will be awarded to the company. We will also be making known, available publicly, the safety and health track record of companies, and then we will the employee insurance will the quantum that each company will have to pay will depend on the historical record of their workplace safety and health results. So we are really taking very concrete steps using the track record of how companies have achieved in terms of workplace safety and health to determine how much insurance premium they pay, to determine whether whether we are going to award government contracts to them. From a worker perspective, we are involving the workers in the workplace safety and health committees within companies, and this is something that is already being done in many parts of the world. In some ways in Singapore too, but we are pushing this in a much stronger way. The second strategy is to, of course, focus on workplace health. And this is not just doing mass health screening and the like, but really talking about trending health of the workforce so that companies can, with good health of the workforce, can apply for incentives, for government incentives to maybe offset some of their operating costs. And the third strategy is to promote technology-enabled workplace safety and health. So some of the very hazardous work that used to be done by humans, we need to make sure that if there is technology available out there that can be done by robots, by drones, for example, this should be done by non-humans. And we are working very hard towards these, along these three strategies. So key changes in WSH philosophy I've covered. I will not go into this. It is on the right is an article that I wrote for one of our local newspapers in Singapore to talk about why Singapore's new approach to workplace safety and health, the three strategies that I spoke about, matters. And hopefully we can get buy-in from employers and from other stakeholders that are involved in the occupational health and safety of our workers. So how are we pivoting to get there? We have a goal to reduce our workplace fatality rate to below 1 per 100,000 by 2030. we've got all these big goals to achieve. How are we pivoting? One of the ways, so I'm going to use a bit of a war analogy, right, to talk about the three ways in which we are pivoting. First is to redefine the war. I said before that the old paradigm used to be a very monolithic, if you like, and though bi-directional relation between work and health. And I think we are all very familiar with this. But going forward, we need to have a new model. And the new model needs to take into account the larger environment that the worker is transiting in, because especially with COVID and with work from home, a lot of there's already a lot of blurring of lines between what we conventionally known as the workplace and what is now the new workplace. And like what Professor Cole mentioned yesterday, right? Apart from working from home, what COVID and technological advancements have allowed many companies to do is to work from anywhere. WFA, work from anywhere. And so in this new model, what we certainly need to do is to look at the interaction between work, not just with the interaction between the health of the individual, not just with the work, but in the environment that he or she interacts with. And we need to ensure that even in the traditional risk assessment of a workplace, this is taken into account. The profile of the workers needs to be taken into account. The health of the workforce needs to be taken into account in our risk assessment going forward. So some of the concepts that I've talked about, and I especially want to highlight point number 2, which is that occupational health needs to engage the social determinants of health. I think we are all familiar with this. But I think I dare say that in many companies today or workplaces today, this is still not practiced in any big way. Certainly, I can say that for Singapore. In Singapore, many of how we manage occupational health at the workplace and how we do occupational health risk assessment occupational health and safety risk assessment continues to be the very conventional method. But increasingly, we need to consider the social determinants of health. We need to broaden, I mentioned earlier, to see occupational health from a public health-based model. So it means that we need to look at it not just from a biomedical model, but a biopsychosocial model of occupational health. We need to shift the focus from looking at the workplace as the focus to looking at the working population as the focus. So now, previously, the workplace is central and everything else, like the machines, the worker, and all that revolves around the workplace. Now, the mental concept must change and the worker is center, and all the other conditions, work as well as non-work, centers around or rather surrounds the worker as the central part, because at the end of the day, the workforce is what we are trying to protect. So, and of course, with advancements in investigative technologies that metabolomics, proteomics, even genetics, if I dare say that, we as a fraternity, as an occupational health fraternity, we must be ready to always inquire, investigate into new technologies and methods, and then be ready to adopt them if it's evidence-based and hopefully cost-effective. And of course, we also need to engage interdisciplinary networks, because the occupational health doctor or nurse cannot just work alone. A lot of times, in order for programs to succeed, we need regulators, employers, and other government and academic stakeholders to be involved as well. So in Singapore, we have done a total workplace safety and health framework, and this is very similar to the total worker health by NIOSH. And it essentially brings together a very holistic, integrated approach to looking at worker health, considering the angles of safety, health, and of course, health promotion. I want to emphasize the last point. It is very important, and Singapore has done this I would dare say quite well, by having a tripartite alliance. So government, employer, and the worker unions all work together, agree on that approach, roll it out. And so there is support from the government and the regulators, support from the employers, and certainly support from the workers themselves in order to ensure that any national policy and programs on workplace safety and health is successful. We have also introduced a AIME framework, very simple: assessment, intervention, monitoring, and evaluation framework. And this is meant to be applied by for workplace assessment by the company and by the workers themselves. So you do not need to, for the companies to have very expensive uh, uh, cost in hiring occupational uh, medicine specialists, for example, or even an occupational health nurse, in order to do this workplace assessment together with the safety officer of the workplace. It is meant to be simple enough for companies themselves, the workers themselves, to be able to do it. And we have rolled this out since pre-COVID in about 2015, piloted in 2015 and rolled it out in around 2017. And it has been quite successful. And we hope to scale it up across the country. This is one of the preliminary result that was published in 2015. And to look at companies, when we did a pilot, companies that adopted a total workplace safety and health framework. And this study found that employees are 7.4 times more likely to be satisfied with their current job, 4.4 times more likely to be proud of their company, and 1.7 times more likely to report work-life balance if the total WSH is implemented effectively within that company. Okay, so I've talked about shaping the war and redefining the war. And redefining the war, we need to change our paradigm, or we need to redefine some of the concepts on occupational health. Let's go to the second part very quickly, which is shaping the battlefield. This is some of the two papers that I found from Lit Search. This was published in 2010 and 2016 respectively. This paper surveys practitioners and see what is the scope of occupational and environmental medicine practice in many parts of the world. So 3 broad categories, and I think this is very similar in both Bangkok as well, in both Thailand as well as in Singapore. The first, of course, is preventive health and injury care, acute injury care. Second is that in a tertiary setting, like where I'm practicing at the Singapore General Hospital, we see more complex occupational diseases and diagnose and manage them. And then, of course, we have occupational health specialists who are also working in the government to define OSH policies, look at trends across the country and globally. So in a large part, this is how many of our practitioners today are practicing in one or more areas of the 3. Going forward, how do we reshape the battlefield? We need to expand the first one. We need to expand the preventive health aspect in occupational health. So we need to expand our focus on preventive occupational medicine and or occupational health. In Singapore, what we have done is that we are bringing in order, because as I will show you later on, Singapore does not have that many occupational medicine specialists nor nurses. What we have done is that we have tried to increase our space by onboarding primary care providers to provide total workplace safety and health services to the workplaces. If you look at the chart on the table on the right, you will know that we are getting primary care groups, general practitioner groups, give them a bit of training and then asking them to provide these services for us. And the reason is a very simple one, because they are there in the community, they are there in the industrial parks and the workplaces. And many of our companies, factories actually have existing contracts with these clinic groups already. And hence, it makes sense to bring these clinic groups onto the program, train them, give them some additional tools and competencies in occupational safety and health so that they can go forth and start doing the first level work for us. And through this, even though we don't have to train many more occupational medicine specialists, we are effectively increasing our presence in preventive occupational health. So some of the lessons that we have learned, we have already piloted this. Some of the lessons we have learned is that many of these clinic groups need government support, right? Need government branding to say that, okay, this is endorsed by the government. And with that, companies and employees are more likely to come on board and spend some resources to offer these services. We have streamlined our total workplace safety and health processes. And we have, of course, taught some of the companies on how to sustain these programs. So this is some of the services that our clinics will offer: health screening, weight management, safety coaching, infectious disease package, mental health package, ergonomics. So you can see that it is really a wide range of topics as well as services that these primary care physicians and clinics will be equipped to provide for companies in Singapore. And on top of that, if we are able to pair that and couple that together with our AIME framework, where companies themselves are also able to do a first level assessment, then it is a synergistic effect overall. What we envisage is that companies, once they have onboarded the total workplace safety and health program, they will be able to do a first level through the AIME framework, and then they can reach out to the clinics that's supporting them, providing services to them for additional second level occupational safety and health services. And last but not least, for workers who unfortunately have occupational diseases or work injuries, they will go to the tertiary level, which is usually hospitals and where I practice. Well, occupational health, of course, have also pivoted towards pandemic preparedness and response. This is happening all over the world. On the left, this is a commentary in one of the local newspapers in Singapore that have written. This was very early in March 2020. So in March 2020, we already defined the key and critical role that occupational health physicians have in protecting the occupational health of our healthcare workers in the pandemic. On the right is a paper, a more recent paper published this year by some of my other colleagues in Singapore, where they give more details about the role of occupational health services in protecting the occupational health of healthcare workers. Apart from that, I think mental well-being is the other part, which I think we all can agree. I have pulled out an interesting paper published in 2019 that talks about who should play a key role in preventing mental disorders at the workplace. And this survey is done in Germany amongst primary care physicians, psychotherapists, occupational health physicians, and HR managers. And the overwhelming result is from this survey is that all the professional groups declared that occupational health practitioners are the best place to address the prevention of common mental health diseases and disorders at the workplace. So this is for primary prevention, secondary and tertiary prevention. Some of the more key stakeholders are reflected based on the study of the result, but everyone from primary to tertiary prevention, occupational health physician has been featured prominently. So for those of you who are interested to read, you can pull out the paper. So this is Singapore Tripartite Advisory on Mental Wellbeing. Some of the guidelines that we have given to all companies, and companies are highly encouraged to adopt, and they will be assessed in terms during audits. This will be one of the areas in which companies will be assessed during audits by the regulators. So last but not least, very quickly, preparing the troops. In Singapore, the healthcare provider to population ratio is about 26 doctors and 74 nurses to every 10,000 population. I mentioned earlier that actually in Singapore, we don't have a lot of occupational medicine specialists. So on the right-hand side, you can see that we only have a total of 43 specialists in Singapore. So slightly more in the public sector, and but we still also have a fairly significant proportion working in the private sector. And the number of active designated workplace doctors, these are primary care physicians whom we give an additional training in the form of a postgraduate diploma, and they are able to do some of the more frontline work for us. And we even those who are actively practicing is about 290 only. So if you look at the occupational health doctor or to the employed persons ratio, in this case, I've already taken a smaller denominator because I've only looked at employed persons. The ratio is less than 1, it's about 0.93. So you compare to the left, where as a nation, we have 26 doctors per 10,000 population. Actually, on the right, when we talk about occupational health doctors to employed persons, the ratio is very dismal. In Singapore, occupational health nurses are not specially registered, and so we do not have that number, even though we know that there are a number of them practicing. So how do? We need to enhance training in occupational medicine, even at the undergraduate level. So this is a very quick, short review of undergraduate occupational medicine training that I published in the journal Occupational Medicine, I think last year. This looks at different types of methodology of training, but I think the big conclusion is that the teaching of occupational medicine in the undergraduate curriculum is a very small one. Certainly in Singapore, in many parts of the world, I'm not sure whether it is the same case in Thailand, but I suspect probably the case as well. And we need to try and see how we can increase the footprint at the undergraduate level and perhaps also at the postgraduate level. So in order to do that, right, we need to, with very small numbers in Singapore of occupational health specialists, general doctors with occupational health training, and nurses, we need to expand our troops, so to speak. So in Singapore, this is an old publicity poster, but we continue to have this course. We have the graduate diploma in occupational medicine course, where primary physicians, primary care physicians are able to attend this 6 months course, and then after that, they will be able to be recognized as a designated workplace doctor, DWD, in Singapore, and it will be able to do some of the statutory medical examinations that's required for workplaces. We need to enroll more workplace safety and health officers as well, give them training and enroll them to do not just traditional safety focus areas, but expand it to workforce health as well. In Singapore, we are beginning to do that. The results is very good, and I hope to be able to share more results with you in time to come. And last but not least, HR practitioners who traditionally tend to be very strong advocates for work-life balance, mental well-being, which is a very big part of occupational health now. It is something that which we must and we should continue to engage them in. So through not just our own fraternity, but expanding the footprint across many different health professionals that have a stake and an interest in occupational health and safety, we are therefore able to expand the number of persons that we can deploy out to look after the health and well-being of our workforce and our workers. So with that, thank you very much. On the right, it's part of my hospital, the Singapore General Hospital, and this is a very short light display that we had last year to thank healthcare workers for all that we have done during the COVID pandemic. With that, thank you so much, and thank you for your attention.
Thank you very much, Professor Tan. I hate you asked me for speaking only 30 minutes, but I know you work so much, you cannot talk in 30 minutes. You have to talk 1 hour or 2 hours. Thank you for your presentation. I think you opened a new mindset for occupational health. I appreciate your expert that you defining war, environment of war, and truth. Yes, this is a very clear cut. In the past, Thailand, when going to Singapore, we always say that you are a small country, you can do anything. But I think it's not true because behind what you work is your tremendous tremendous trying to make something and to change something to the good. And I think it's a very good model. In Thailand now, the accident rate is high. We have about 20 per 1,000 workers. The injury rate is still very high. And the government try to collaborate with the Ministry of Labor, Ministry of Health, and Ministry of Industrial. Uh, and we have a campaign, Zero Accident. But I think it's not work or it's still working. I don't know. But it's not very clear and very not well communicated with the occupational physician. I want to ask you some questions. Uh, how about the occupational physician in Singapore, where they work almost in the university or in the factory?
Thank you, Dr. Adu. So in occupational physician, in Singapore, many of our occupational physicians now, in the past, many of them work in factories and in multinational, not so much multinational companies, but in factories and of course universities. But in recent years, I would say in the last 5 years or so, sometime from 2015, 2016 onwards, we are seeing that a big growth in the number of occupational medicine specialists in hospitals because we want to focus on tertiary care for our workers, and there is an increasing recognition that even, for example, asthma, and the respiratory physician can be treating the asthma. The dosage keeps escalating in terms of steroids, but the asthma is not under control. There's an increasing recognition that many of these common diseases or skin diseases have an occupational component. And so one of the big growth areas in Singapore in terms of career for occupational physician is in a hospital setting. And in fact, I can share that at the Singapore General Hospital, while we are 200 years old, right? So our roots can be traced back to 1821, and we celebrate 200 years this year. My department is a very new one. My department was set up in 2017, so we are only about 4 plus years old, and we are continuing to expand. And I'm looking for doctors to bring on board as well. That's one area in tertiary hospitals. The second growth area for occupational medicine specialists is in multinational companies in Singapore. And Singapore is bringing in a lot of multinational companies to have its regional headquarters here. And with that, I'm seeing a lot of opportunities for occupational medicine specialists to join. Of course, corporate occupational health is very different from what we practice in the hospitals. But it's still an important part, and because they focus, and corporate occupational health focuses a lot on prevention, which is important. I have got doctors from my department who has since joined the multinational companies. So these are the two growth areas in Singapore. In the hospitals, where you want to build up tertiary occupational medicine at a very high level, and of course at the second area is in corporate occupational health services provision for multinational companies.
Thank you very much. Does anyone have a question with Professor Gan? Okay. If someone has a question, you can type in the chat, and I will send the question to Professor Gan by email. We will answer to you directly after that. Okay.
Thank you, Dr. Adu. I've also included my email address on the chat. So if anyone has any queries, you can, I mean, it doesn't have to be for this conference, but But even beyond, I hope to also get to know many of you when we are able to have face-to-face conference in the future. Thank you.
Yeah, thank you very much.